Well, welcome to this Canmore Trust podcast. I'm John, and I am the Chief Executive Officer of the Canmore Trust, and it's my pleasure to be here to introduce a very special guest today, and I'll come to who she is just in a second. Inevitably, this Canmore Trust podcast will deal with difficult subjects around mental health, mental ill health, and suicide. And so we want you to be safe as you listen. Please feel free to text at any time, Canmore, Canmore, to 85258, and go to our website, thecanmoretrust.co.uk, for a whole array of supportive resources there. So, Haylis, many thanks for being here for the Canmore Trust's first ever podcast. And I hope you feel honoured, because I feel honoured having you in the room. Many people who are listening may know you, but many won't. So please, can you tell us about yourself, about your background, and how you've ended up as Scotland's National Suicide Prevention Delivery Lead?
Hi, John, and thanks for having me. It's great to be here and to be the first guest. I'm very honoured, yeah. So I'm Haylis. I guess first came into the world of suicide when my uncle took his own life when I was 16 years old. And I think up to that point, I wasn't even aware of the word suicide. I'd been raised in a Catholic family and Catholic schooling. So suicide at that time was still a sin. And so that kind of brought a whole swathe of information and knowledge that I had never really been aware of previously. And Joe, my uncle, was like my big brother, so it had a massive impact on me and on my family's life. And I guess it kind of set a seed of never wanting another person to feel like Joe had felt, and never wanting another family to go through what we had gone through. Professionally, I trained as a nurse, hurt my back, couldn't nurse. Was medically retired at 23, and so then tried to find my way and did some research work, and then eventually ended up at university studying social sciences. And at the same time, I was volunteering as a Samaritan, so had done that for a number of years in the borders. And when the Scottish Strategy and Action Plan Choose Life was launched in 2004 to help reduce suicide rates, there were local suicide prevention leads appointed across the country, and I was very honoured to be the first one in Borders. And so I've worked in suicide prevention and mental health and addictions ever since then, and came into this role about 2 years ago now to lead the Creating Hope Together Strategy and Action Plan. So I'm very privileged to do so.
It's a great resume of life to date, I guess. You've said a little bit of how impactful suicide can be. And I've found myself in similar circumstances, having lost to suicide. And I now find myself very much part of this new community of people that I would call the suicide community. From where you sit, do you think the term suicide community is a helpful term? Is it a useful term?
Yeah, I guess over that 20 plus years now that I've worked in this field, I've seen language change quite considerably around suicide. If you go back and read the first line to the Choose Life strategy, it says something along the lines of, we want to stop people committing suicide, and we would never use that language now, quite rightly, because suicide isn't a crime. And I guess over time, for me, is the language right? If that's what people feel is right, then it's absolutely the right language. Who am I to say you shouldn't be using that terminology? I guess I always reflect that it's a community that nobody wants to be part of, but it's an incredibly welcoming and supportive community when you are part of it. And so if people feel part of our community, then great. And I hope that we can take that suicide community and use it to drive forward change in supporting people who are at risk of suicide and those who lose people to suicide. So I guess the word community gives people a home and a
Indeed.
place to be.
Indeed. And I guess I would say if there are those who are listening to this podcast who have lost to suicide and feel remote and distant, then I would say, please reach out and come and be part of what I have found to be an incredibly supportive community. Haylis, one of the reasons behind the Canmore Trust podcast is that I think we need to hold each other accountable. Public servants, those that have office in charities serving the public, we need to be accountable. And so I'm going to cut to the chase with our discussion today, because the suicide numbers across the United Kingdom are not going down. What's going on?
So that's a big question, and I wish that we had the answer. Suicide is incredibly complex, and it's not one thing that's leading to people feeling like suicide is their only option. And so I guess when I was reflecting on, what is going on, as I do, when those numbers are published every year, I think of all those families that have been affected by suicide and wish that those numbers were at least heading in a downward trajectory. But it is so complex. And when I look at my own queenagers, as I call them, in their 20s now, and I think about, some of the struggles that they have, having been through COVID and all that brought, cost of living crisis, that, where many people are now living, hand to mouth and
Sure.
With not the same resources that they once had, poverty, trauma, abuse, climate change, social media, wars across the world. There are all these things that must contribute to people feeling like this is not the place for them to be. So I don't think it's just one thing, and I know that it's not, and so how we address that then has to be very complex as well, because there's not just one solution to solve this.
Okay. Blank sheet of paper, unlimited budget. Please tell me what you would do to bring numbers of suicides down dramatically and quickly.
Again, not an easy, so there's no easy solution to it. I think there are families who have the generational trauma that, goes back so many generations now that it's very difficult to, just throw money at something and fix that kind of problem. Generational poverty that goes back many generations now, that's very difficult for people to see a way out of, even if you were to give them a big sum of money to fix all that. I think that, I guess in the same way that I answered the previous question, there's not one size fits all. There's no single solution. And we certainly, when we were doing all the engagement for the Creating Hope Together strategy and action plan, heard from hundreds of people across the country about the different things that we needed to do. And I'm not saying we've got it entirely right, because clearly people are still taking their own lives, but I think we've got many of the right things in place to be looking at a whole of government approach that for the first time we're really looking at where are the policy areas that we need to be influencing to help them understand what their contribution is to reducing suicide. So working with people who work in child poverty, for example, housing, education, all of these different policy areas where they are now having conversations about what they can do to contribute to reducing suicide. So I think, taking that approach that thinks about what's the preventative actions, what are the early intervention actions, what are the intervention actions at point of crisis, and what are the post-vention, how we support somebody after they've lost somebody to suicide. Having all of those things happening I think is really important. So yeah, there's not just that single thing that we could do. I think even if we wrapped people up in cotton wool, if we wrapped the entire population up in cotton wool and kept them all in a safe space, there would still be somebody who would find a way to take their own life. And so we need to have that multi-pronged approach.
You have quite a tough job. Not only do you carry the expectations of the country, I guess, in terms of the suicide prevention plan and its implementation, but you also live in a world where you hear stories on a very regular basis of the carnage that suicide brings. Are you safe? How do you look after yourself?
I guess I practice what I preach. So there are very few people who come into contact with me on a day-to-day basis who do not know how I'm feeling and what I'm going through on that day-to-day basis. I talk. I get it off my chest. I don't sit with stuff. I will talk to anybody, and as you well know, I'll talk to anybody. And I think that's really important. If I'm not able to get it out of my head, then it does sit with me. I am an empathic person. I feel deeply for the impact that suicide has on people, who have been affected in whatever way they've been affected by it. I've lost an uncle to suicide. I also have other family members who have attempted suicide, and so I know how that feels. So talking, I've got great family, great friends, great contacts at work, colleagues at work who support me. I walk, I make things, and I try and have fun in my life as well. Spend a lot of time laughing and having fun with my daughters.
That's great. Good to hear. We've talked about suicide. I'd like now just to talk for a few moments about the rates of people who make an attempt on their life and who survive. We don't know the actual numbers of that, but it's estimated by a major UK mental health charity to be around 500,000 per year, which seems a huge number. Two things I guess I want to ask you. We don't seem to formally record these data, and should we? It seems that we should, but can you talk to us a bit about that? And what are we doing about this? What are we doing about these huge numbers of folks making an attempt on their life?
Yeah. It's an incredibly difficult thing to record, because very often people attempt suicide in their own home and we never get to know about it. Their attempt doesn't lead to death, and so they just sit at home and recover or go on to attempt again. There's no single place that people go to when they attempt suicide. Mm-hmm. So it is incredibly difficult to record it. And even in places where people do go, like accident emergency departments, they're not always going to say that they'd attempted suicide. Some injuries can look like accidental injuries.
Sure.
So it's recorded in accident and emergency as the thing that brought somebody in. So, whatever that might be. And so it's very difficult then to differentiate between the real accidents and the things that people have done to hurt themselves. So I don't think we'd ever get to a point where we had a really accurate picture. That said, we are doing work now to try and improve the data in places where we could collect it. Mm-hmm. So Public Health Scotland are working internally there to look at what data they get through out-of-hours GP practices, through accident and emergency ambulance service, etc., to build a better picture of that. And that'll be a bit of ongoing work. What are we doing about it? alongside our suicide prevention strategy, which does look at what we need as a sort of preventative and an early intervention approach. We have the self-harm strategy now, which is a first in the world, I think, that there's a separate self-harm strategy. And the Self-Harm Network Scotland has a website which has some amazing resources, some, great support through Self-Harm Network Scotland for people who are self-harming or somebody who's worried about somebody who self-harms. And obviously not all self-harm is an attempt at suicide, but some is.
Yes.
So those kind of things that are, available to people will hopefully help as well.
You have been applauded internationally to the level of the World Health Organization for your work, including individuals with lived and living experience informing policy and strategy for suicide prevention. Have we more work yet to do in lived and living experience?
Undoubtedly we do. I think I just want to say I personally haven't been applauded, but certainly the work that our lived and living experience panel, our youth advisory group and our participation network have done has been recognised as, a good model of involving people with lived and living experience in the work. And everything that we do is, developed and delivered with individuals who have, lived and living experience. And I'm eternally grateful to them for their time to support the work, and it is undoubtedly better for it. I think we have in our vision to reduce suicides whilst tackling the inequalities that contribute to suicide. And we've done a significant amount of work over the last couple of years, engaging with organisations who work with people who have experienced stigma, discrimination and the socioeconomic factors that contribute to suicide, who are often unheard voices, and that's not because they haven't been shouting, it's because they haven't been heard.
Yeah.
And I think that, we've been building those relationships to hear those voices and to hear about their different experiences of suicide, of seeking support, of, asking for help. And I think we need to do an awful lot more to make sure that their voices are heard and that we are developing things in a way that is not just fit for the few people that we have sitting on our lived and living experience panel, but for a much wider audience as well. And certainly we're committed to doing that.
Okay, thank you. I guess some people listening to this podcast might be surprised that recording a death as a suicide is not a pure science. I think I was after Cameron died. And I encounter this all the time. Please, can you help us understand why someone who appears to have died by suicide isn't automatically recorded as a suicide death?
Yeah. So no death certificate will have the word suicide on it. And it has the cause of death. So whatever it was that caused that person to die will be the medical terminology that's used on the death certificate. And then there's a whole investigation that happens through the police and the Procurator Fiscal, putting the picture together about that individual who has died and trying to work out whether it has been a suicide or it hasn't, based on that, that information. So it's not an exact science, and it's not always an easy thing to do. So, and I'm sure as somebody who's lost somebody to suicide, you would want to make sure that if it wasn't a suicide, it wasn't counted in those figures, and equally if it was a suicide, it
Indeed.
was. So I guess, we do the best with the evidence that's available to us to decide whether it's a suicide. And all that information goes to National Records Scotland, and that's how the figures are collated.
So who makes the final decision about whether it's a suicide or not?
That happens, I guess, based on what the Procurator Fiscal has said. The Procurator Fiscals are the ones who decide whether it's a suicide or it's not.
So does that mean that the numbers of suicides in Scotland could actually be higher than the reported figures?
I think there's a reality that we know that not all suicides will have been counted.
Yeah.
Equally, we know that some deaths in Scotland are counted in our suicide figures that might not have been suicide. So we have in Scotland a very robust process, as robust I think as it could probably be, and our suicide figures are suicides and undetermined intent.
Okay.
So all the figures that we see published from National Records Scotland are also include those undetermined intent deaths. So that's where we can't be 100% sure, but on the balance of probability, it could be a suicide. But we know that there are some of those undetermined intent deaths that absolutely were not suicides, because they also count things where they just couldn't be sure whether it was an accident or something else. So
yes,
there's always going to be a bit of a question mark over the exact numbers.
Yeah.
But it could be higher, and it could also be lower.
Okay. So I guess the decision is made on balance of probabilities with all the evidence that is before the Procurator Fiscal.
Yes.
Yeah. And that leads me really to ask this question, because Scotland sits differently from the rest of the UK in that we don't have a coroner's inquest into each suicide death. And having worked with a number of families south of the border now, I understand that the coroner's inquest can be really quite activating or reactivating of grief, because it can happen months or years later. But at least it feels that system leaves no unanswered questions for families, because I think in Scotland, I often meet families who have unanswered questions. And I wonder if Scotland needs, I know we don't have a coroner's inquest system, but I wonder if Scotland is needing something similar, a robust legal process whereby families are left with no unanswered questions, friends are left with no unanswered questions, and that every suicide death leaves a legacy of lessons learned. What are your thoughts on that?
So I'm maybe going to be controversial here, John, because I wonder if that coroner's system actually does answer all the family's questions.
Okay.
And I would challenge that assumption.
Okay.
Because I would imagine that there are many of those coroner's inquests where the outcome is it was a suicide, but the understanding of why and what contributed to that may never be known. And so I suspect there are still a number of families who have been through that process who would still feel there were unanswered questions for them. So I think that's one thing. Should we be doing something to help our understanding of what has contributed to somebody's suicide? Absolutely. And in circumstances where somebody has been in contact with a mental health service in the 12 months prior to their death, they will go through a significant adverse event review. And there are a number of suicides that end up in a fatal accident inquiry as well. There is a process going through Parliament at the moment to bring in a bill to review the deaths which have a connection to domestic abuse, but whether they are homicide or suicide deaths. So that will also be another process. And the child death review process also exists for people under 26 if they've been in contact with the care system, and for other children and young people up to the age of 18. So I think there are a number of processes that happen, and that's before you start to get into child protection and adult protection cases as well, which will also be reviewed in some way. We are working just now with a number of local authorities to look at or to bring in multi-agency reviews of all deaths by suicide. And, we've brought in a system that helps at least collect that information, so we will have better understanding of the factors that have contributed to somebody's suicide.
And is that simply being piloted at the moment?
So at the moment, we are sort of phasing it in. So it's a voluntary thing for local areas to do. We've got 7 local authority areas at the moment who are actively using the system, and a number that are working towards bringing it in as well. And, over time, we hope that people will see the benefit of using that system.
And just
having
explain
those
that for us
discussions.
then. That's multi-agency
Multi-agency.
practitioners sitting round in a room, the death in front of them to be considered. Are the family included in that? Are the family excluded from that?
So the system at the moment, so there is a database, for want of a better word, that helps different agencies put in the information that they know about that individual. And that will allow the opportunity for agencies to get together and sit round. The advice or the guidance to local areas is that families should be involved in that process.
Okay.
I'm not sure that sitting around a table with the agencies involved necessarily is the most helpful way to do that, but certainly we've given some guidance into how families could be involved in that process.
Yeah.
For me, none of these processes are any good unless they give us some useful information that helps us understand better what we can do differently to help prevent suicide.
Sure.
So there is no point in us having all of these conversations if they don't turn into learning that can then be put into place. And from conversations I've had about the coroner's inquest system, that doesn't always happen. So there can be learning, but that there's no sort of legal duty for the organisations to then respond to that learning and take action. Yeah. And so, my sense is that by encouraging local areas to work together to do these reviews, that actually is more likely then to lead to local action to make a difference. And certainly those are the conversations we've had over the last few years where we've been working and bringing that into Scotland. So that I think is really important. We do also already know a lot about the factors that are involved in suicide, that contribute to suicide. And I know you know Rory O'Connor very well, and his IMV model really sets that out quite clearly. Sure. And that's certainly a model that we use when we were developing the strategy and action plan, to think about what are the different things, the different approaches we need to take in order to address all of those things that appear in the IMV model as well.
Okay. I think often those who aren't directly involved with the processes that you're describing look on and see lots of things happening and maybe don't understand fully what's going on. Could you just spend some time describing the various advisory groups and the reporting structure within Scotland? Because I think people would find that really helpful.
Yeah, I'll do my best.
And no acronyms. And all acronyms have got to be explained.
Got to be explained.
Okay.
Well, I'm not explaining IMV because they're big words and I can't say them.
Okay.
But I will explain the kind of structure that we have in place now. So the strategy and action plan are co-owned by COSLA, that's the Convention of Scottish Local Authorities, and Scottish Government. And I think that's really important because that sets out the intention that this is not just a national government strategy, that local government are really important players in this as well, because there's a lot of work happens across our communities. So having this co-owned strategy, I think, is really important. I report jointly to them. So as the national delivery lead, I have responsibility for making sure that the work is happening.
Two bosses.
Two bosses, yep.
My goodness.
And I describe myself as a bit like a patchwork quilt maker. So I'm making sure that all the bits of the patches or all the patches are together, so we've got the right picture in place. I'm supported in doing that by some of the main charities in Scotland. So Samaritans, SAMH, so that's Scottish Action for Mental Health, Change Mental Health, Penumbra, and Public Health Scotland, who also are supporting the delivery of the work. So they are what we call our outcome leads. And our strategy has 4 long-term outcomes to, hopefully get to enact our vision of reducing suicide. Our sort of theory of change, if you like. So we've got those outcome leads. Underneath that, I think last week I counted there were 17 different organisations involved in delivering all of the actions in our action plan. That's 38 different people who are delivering the work of our action plan. And that's not even probably a drop in the ocean of what happens in this country around suicide prevention. So part of our ambition for this strategy is also to create a delivery collective that goes beyond just those people who are delivering specific actions. So that brings in all the charities and much smaller organisations who, you know, are doing some brilliant work across our communities, you know, and help them connect and to feel part of our sort of bigger community.
Back to community again.
Back to community again. And our local suicide prevention leads, so virtually every local area across Scotland, every local authority has an identified suicide prevention lead who develops, you know, their own local action plan based on their local needs and helps to drive work across our 32 local
But I'm right in
authorities.
thinking that those individuals wouldn't necessarily all be full-time in that role.
No,
there
they're-
might be a huge variation in hours worked in suicide prevention across the country.
Yeah, absolutely. So there is a, you know, a huge variation in capacity and resource to do that work, and they do some phenomenal work with, you know, the money and the capacity that they have to do that. So there's a wide, and you know, and that's not counting all the individuals who also have, you know, been bereaved by suicide or impacted by suicide in some way that also contribute often to that work. We talked a bit earlier about our lived experience. So we have a lived and living experience panel, which is made up of 17 adults who have been impacted by suicide, either their own suicidal thoughts or actions, behaviours, feelings, or that they've lost somebody to suicide. We have a youth advisory group where we have a number of young people across the country who, in a similar way, have been impacted by suicide and who contribute especially to the actions that are around children and young people. But, you know, often they come with some very innovative and creative ways of thinking about other parts of the work as well. We have our participation network, which is a group of about 50 organisations now who support children and young people across the country who come and contribute as well to how we take things forward. We have an academic advisory group, so based in Glasgow University, and they are very reactive and do a lot of work for us, looking at what the academic evidence suggests we should be doing and where we should be driving work forward. They also have connections into a much wider academic advisory group. I think they did a bit of an audit for us at the latter part of last year, and I think there were 75 different academics across Scotland working on suicide prevention. So, you know, we're also really keen to hear from them and to, you know, learn from their research work. So that's our delivery collective, our academic advisory group, our lived and living experience group, our youth advisory group, our participation network. And the final bit of the puzzle, I guess, is our National Suicide Prevention Advisory Group, chaired by Christine Goodall, who was responsible for setting up Medics Against Violence. And that group is, its membership is representative of the sort of inequalities that connect to suicide, that influence suicide. So rather than being suicide-specific organisations, we have people from the Poverty Alliance, Who Cares Scotland, the Institute of Directors, so that we also have that private sector input, education, ED, emergency departments, psychiatry, primary care, so and inclusion health. So a huge range of experience sitting around that table who help us, especially around the sort of strategic direction we need to take.
And all of these have informed not only the strategy, but now the operationalisation of that strategy.
Yeah. So we create a delivery plan every year around how we're going to deliver the actions and the action plan over the next 12 months. And we report on that every year as well, publish an annual report on the progress that we've made.
Are you making progress?
I like to think we are, yep. I think it's sometimes very easy when you are, or very difficult rather, when you're in this kind of work to just be continuing and carrying on and not recognising, I guess, what difference you are making. And I think writing the annual report every year gives me a real opportunity to stop and reflect on the work that we've done over the last 12 months rather.
It feels like 12 years, yes, I understand.
And I, you can see where difference is being made. We can see where, in the whole of government work, where those conversations are leading to action. So, what Social Security Scotland are now able to do in terms of raising awareness or referring people into local areas who they believe are at risk of suicide. That's something that's new. Having suicide mentioned in the national planning framework when developing new buildings, thinking about the risk of suicide, that's new. So these things that, might not lead to a difference immediately, but are, sort of longer term differences that we might see.
And time-space compassion, wonderful initiative, wonderful programme. Where has that got to?
Yeah, so I think that, time-space compassion is one of our key pieces of work. It's threaded right through our actions. We develop time-space compassion really in response to...
And incidentally, if anyone watching or listening doesn't know about time-space compassion, just search time-space compassion and there's a Scottish Government piece on all of that.
Yeah. So we have our time-space compassion approach guidance and framework that sets it all out. A number of podcasts, a number of practice stories that help people see where time-space compassion is being put into practice. I think it was a piece of work in response to what did we need for crisis support. And time-space compassion was what people said. There wasn't a specific model. They just said we need the time and the space to explore what we're feeling and to be shown compassion. And so that was its origins, I guess, where we see time-space compassion now showing up. It's not just in that crisis support. It is, throughout. So we know of a number of particularly third sector charitable organisations who have time-space compassion as their core, as their approach to delivering all of their work, whether it's a preventative action or it's a crisis intervention. And so I think it's sometimes very easy when you're in this work to be, because I know all about it and I connect with lots of people who know about time-space compassion, you can become a bit complacent that it's going where you want it to be. But it's also showing up in other places where you might not have expected to see it. And I think, that is Linda Hunter, who leads that work, has done a phenomenal job in bringing together some of those practice stories that show where time-space compassion really is across our communities. And long may it continue, I think.
Thank you. You know our Gibson family story well. You know that we lost Cameron in October 2019, aged just 24. 5 years have passed. I can't believe that 5 years have passed. As we sit here today having this discussion, can you reassure me that Scotland is a suicide-safer country than when Cameron died in 2019?
So I'm going to say yes. And the reason I'm going to say yes is I think since 2019, we have a long-term strategy that has a commitment to improving suicide prevention in this country. And we haven't had that for a long time. We have a phenomenal group of people delivering that work at a national level and at a local level. And the drive and commitment that I see from those people to go the extra mile. I mean, when I write it down and see what those people are achieving, I think it's really impressive with the resources that we have to do it. And the opportunity now to extend our reach, if you like, into all those little organisations who've been set up across the country, often because they've lost somebody to suicide. I think bringing them into that community and helping them connect with each other and helping them connect with the national work and helping them influence and shape that national work, I think helps to make Scotland a suicide safer country. We are working at the moment to develop the first campaign from Suicide Prevention Scotland, which will launch in the middle of April, along with our online resources. A website that will have support or information about support for people who are thinking about suicide, for people who are supporting people who've thought about suicide or are thinking about suicide, and for people who work in suicide prevention as well. And I think that creates another community in Scotland that helps to improve suicide prevention. So I'm optimistic, but I'm not complacent. And I know that there's still an awful lot for us to do.
Thank you. It seems to me that, and this leads on, I guess, from the discussion we've just had, but it seems to me that charities and other organisations involved in suicide prevention and suicide prevention probably don't do enough joint working. So I guess that, as I look on, I think that increases the risk of duplication of effort and duplication of spend with no obvious benefit. Do you agree with me on that? And then secondly, before you answer that, regardless, how do we improve joint working across the sector?
So I think that I both agree and disagree. I agree it could be better, and I'll come back to how we improve that. But I also believe that people need choice. So there is a risk that if all organisations combined and there was a single offer, that it wouldn't be the right thing for lots of people.
Okay.
So I believe that people need choice and deserve to have choice, because Samaritans is a wonderful organisation, but it doesn't meet everybody's needs. And so we have Breathing Space, and we have some other like Shout and lots of other helplines now, Papyrus, who have a slightly different approach. And I think we need all of that so that when people are at that point of thinking about suicide, they get access to the help that they need. So I think that's a really important part. But I do think there are opportunities for people to come together. And I think we've started to do that. We've had an annual event the last 2 years where we've brought together some of those much smaller organisations who haven't previously had a chance to come together to know about each other. And I think that, that's a really key thing to...
And we've benefited from that.
Yeah.
The Canmore Trust has benefited from that.
Yeah, and to help connect those organisations who are perhaps doing very similar things in different parts of the country.
Sure.
Our work around peer support has really helped that bring together a lot of peer support organisations as well. And so they're able to support each other. And I've seen that in practice. I see little organisations who are now working closely together or know each other and are able to pick up the phone and have a conversation about things.
Yeah.
So I think that, that's a really important part. We've now got, a suicide prevention network where I think that the last count, there was 350 members across all sectors who come together to join our network sessions that are run every quarter and get our newsletter that updates them on what's happening. And so I think making sure that we are communicating with people in a way that helps them connect is really important.
Do you feel that you sit at the centre of that connectedness? Does it feel sometimes that wherever you reach out or touch, there's another person, there's another connection, there's another conversation to be had.
Always. Yeah.
Exhausting.
I guess I get my energy from speaking to people and from hearing about the good work that people are doing and being able to share that with other people. Do you know, I think that's a motivator for me, do you know, to share that and to help other people see where they can work collaboratively or support each other to do things. I mean, I've got a ridiculous number of emails that come in every day, but I do often read an email and think, it would be really good if they connected with that other person over there, and I'll send an email just saying, you know, you two are doing similar things, so, you know, why don't you at least have a chat and be there to support each other? So yeah, I mean, I described myself as a patchwork quilt maker earlier, and I think all those bits are really important in driving forward this work and in making a difference. Yeah.
This is a tough question, and I apologise for asking it, but it's an important question. Your uncle was hugely influential in your life, and his death was hugely influential. What would you want to say to him?
It's a tough one. It's a tough one. I'd give my back teeth for Joe to still be here with us. I'd love him to have met my children, to have been part of all the things I've done in my adult life. But without Joe dying, I would not be doing this job.
You and me both.
And I feel that I've brought a lot to this work because of Joe dying. So it's a tough one. If I went back to my 16-year-old self, she would absolutely want Joe to still be here and to ask for help and get that help and thrive and be the great human being he could have been. He was.
So legacy is a huge part of this.
It is, yeah. Yep. Legacy for Joe and also to help those who have been close to me, who have been at that point of suicide themselves, who have attempted suicide. So to make a difference for them as well.
So let me just extend that thought a little bit. So if someone is listening today, Haylis, or watching this podcast and thinks this world is a place I don't want to be, and is planning to take their life today in this moment, what would you say to them, please?
I'm going to reflect back on a podcast I listened to a number of months ago, which had Joe Trancini, I think his surname is, as a guest. And it's a podcast called 3 Little Words. And one of Joe's words was wait. And he used that word to help him stay alive when he was feeling suicidal. So I would say wait, talk to somebody, ask for help, use that word suicide, tell somebody you are thinking about suicide. Because in my world, I am fortunate to meet hundreds of people who want to help. Hundreds. So trust me, there is somebody out there who will help. And if it's not the first person you tell, then tell somebody else. And keep telling them till you find one of the hundreds of people I get to spend my time with who would want to help.
Thank you. So helpful. Haylis, we're nearly done. You'll be glad to hear that. I just wanted to say thank you for all that you do to make Scotland a safer country in preventing suicide and in supporting the many thousands of us who have been impacted by suicide. I'm grateful for that, and I think the country is a better place because of the job that you do. But I touched on this earlier, and I want to ask you again, as you leave this place today as you step away from this podcast back into a busy life, great demands, huge demands, governmental demands upon your time, your energies, your intellect. How are you going to stay safe in the context of the sadness you encounter and the good things that you encounter each and every day?
So I'm going to go from here today and have lunch with my daughter, and that's always a joy. It cost me a fortune.
Yeah, I was going to say, is it a joy that you always have to pay?
Always a joy, yes. It would be remiss of me to be sitting here saying my life is all wonderful and everything is great, and I'm absolutely 100% resilient. For me, resilience is not about just being able to bounce along, being happy and jolly all the time. There have been times in my life where, I have felt at rock bottom and things have been incredibly difficult. And at those times I have reached out for help, which is another reason I know that it works. So I have had counselling, many years worth of counselling to help me through some of the things, the challenges that I've had in my life. And as I said, I will talk to anybody now, because why pay for counselling when people will give you it for free? And I think I'm also very good now, and I think that's as a result of the counselling, of knowing when it's time to take a break and to stop and to step away. And I think that's really important for everybody who works or is connected with suicide prevention work. It's an incredible topic to work in because there are so many incredible people. I'm fortunate to count many of them as friends now, like yourself. But it's also a difficult topic to hear, and to carry people's pain is really hard. And so I think you have to be good at it, you have to be able to say, it's time for me to take a break as well. So I do also love 2 weeks in the south of France every year, lying by a pool doing nothing.
And richly deserved too. Haylis, I just want to say thank you for being here today, for giving of your time. We, the Canmore Trust, and I'm sure everyone who will view this podcast, appreciate it hugely. And similarly, I count it a privilege to call you a friend. And I look forward to journeying many years ahead together. Consider yourself hugged. Thank you very much indeed.
Thank you, John. That's the key thing, hugs.
Thanks so much. So just a reminder as we finish this podcast that your safety and your well-being are so paramount. You're loved, you're valued. Please, if you're struggling at any level today, would you take Haylis's advice and step back, wait, and speak out? Go and speak to someone now that you trust, or make yourself able to speak to one of the national agencies that may help you at this time. You can text Canmore to 85258 or see our website, thecanmoretrust.co.uk, for an extensive list of resources. Please reach out. Thank you.